Hi, my name is Haley Sisel. I'm a senior studying biology, global health, and gender and women's studies, and I'm honored to have the opportunity to share with you our project today, employing a One Health approach to address the implications of mycotoxin exposure in rural Guatemala. Before I get started, I want to thank my mentor and partner for this project, Dr. Claudia Calderon, our community partner, Red Cuchubal, and the Mortgage Center for Public Service, who awarded us a Wisconsin Idea Fellowship last year. Now, mycotoxins are naturally occurring toxins produced by certain fungi, and they actually contaminate about 25% of our global food supply. They're extremely toxic to vertebrates, even in low concentrations, and can lead to things like liver cancer, neural tube defects, and immunosuppression. Although the bulk of the mycotoxin research is on aflatoxin and fumonisin, the estrogenic mycotoxin zearalenone is concerning because it's inducing feminization in animals and can interfere with ovulation, implantation, fetal development, and ultimately the viability of newborn animals. In humans, it disrupts hormonal balances and can lead to issues with prostate, ovarian, cervical, or breast cancers. And although many wealthy nations like the United States and international organizations like the World Health Organization have enforced regulation of mycotoxin prevalence in food and livestock feed, other countries like Guatemala lack the resources and governmental support to do so. Additionally, in Guatemala, and particularly in rural areas, maize is a dietary staple that's often consumed to the exclusion of other foods, and biomarker-based studies have found that those relying on maize as a staple crop are actually consuming very high levels of mycotoxins that are exceeding the provisions set by the WHO. So recognizing a gap in the literature on zearalenone and the applicability of the One Health approach to this situation, we aim to identify the ramifications of excessive mycotoxin exposure on animal and human well-being. We did this through three main activities: assays, interviews, and education. So first, we asked 30 farmers to bring in 1 to 2 samples of maize that we could use to test. So while Dr. Calderon was leading a workshop on best agricultural practices to eliminate mycotoxin contamination, like storing and drying, I was performing these lateral flow assays. And we intended to test for aflatoxin, fumonisin, ochratoxin A, and zearalenone, but as you can see here, we only collected enough data on aflatoxin and fumonisin after dealing with some faulty tests. We later worked with the company from whom we purchased the assays and provided feedback that would allow the zearalenone test to be more user-friendly in the field. Nonetheless, considering Dr. Calderon's concerning findings the year prior, we were very surprised to see that the average levels of aflatoxin and fumonisin were well below the provisional limits, which you can see on the right-hand side here. We acknowledge that convenient sampling is certainly not the way to go here, and we wish that we had the infrastructure and funding to randomly sample. However, we were resilient and we still managed to make a huge impact in the community through our educational efforts, which is what I'd like to talk about next. After conducting interviews with professionals from various disciplines and occupations, we created both an online network and a database of mycotoxin literature specific to Guatemala. And they hope to use this to mobilize and effect some change in the way that the Ministry of Health surveils and regulates mycotoxin contamination in food and feed. I also created infographics on the 6 major mycotoxins and how to avoid them, and these were shared with Red Cuchubal and intended to be used in future training of community members. Ultimately, what this project taught me was the importance of centering and engaging with the community in which you're working. Relevant to the theme of this symposium, the community members taught us one of their strategies for reducing mycotoxin proliferation. It's called Dobla la Milpa. So although academia can be very powerful, our research efforts will not be successful if we do not tap into indigenous wisdom and insights. Thank you so much for being here.